Okay, let's unpack this. Chances are, if you've scrolled through, well, pretty much any news feed or social media lately, or maybe even just overheard a conversation, you've probably heard the buzz. There's this particular medication for weight loss that just feels like it's everywhere right now. You see it in, serious scientific journals talking about groundbreaking effects, but also all over online platforms, people sharing their stories. So today we're doing a real deep dive into Wegovy. That's the brand name. The active ingredient is semaglutide. And we're looking at its truly significant role in, well, the whole landscape of weight management, right? So our mission for this deep dive, it's pretty clear. We want to cut through all the noise, sometimes the hype, maybe some confusion too. We want to give you, our listener, a really solid, well-informed, scientifically grounded understanding of what this drug is, how does it actually work, biologically, what does the actual science say, the hard data, and maybe most importantly, what does all this really mean for people trying to manage their weight, which is, let's face it, complex. To do this, we've looked at a ton of sources. Seriously, over 200 scientific articles, medical papers, clinical trials, reviews, all published right up to August 31, 2025. So you can be sure what you're hearing is like the most current, thorough look we could possibly give you. Get ready to come away not just informed, but maybe with some genuinely surprising facts, some practical things you can actually use. Okay, just one quick but really, really crucial note before we dive into the science itself. This deep dive, like all our deep dives, it's strictly for educational purposes, okay? It's about exploring the science, the information that's out there in these sources we looked at. It absolutely does not replace professional medical advice. It just can't. So please, always, always talk to your own doctor, your healthcare provider, before making any decisions about your health or treatments. Super important. Your situation is unique.
Yeah, and you've really hit on the perfect starting point there. The sheer amount of talk around semaglutide, it's genuinely fascinating. It's more than just buzz. It really does feel like a pivotal moment, maybe even a paradigm shift in how both the medical world and, the public increasingly are thinking about something as complex, as widespread as obesity. For such a long time, obesity was often seen too simply, right? Like it was just about willpower or maybe a lifestyle choice. But that view, thankfully, has really evolved. Now, it's widely recognized, formally defined even, as a chronic, complex disease, just like we think about high blood pressure or type 2 diabetes. Chronic conditions. And that's such a critical distinction because it changes everything. The medical approach shifts from, well, frankly, from blame to focusing on comprehensive evidence-based treatment. And the numbers, the statistics, they really highlight why this shift is so necessary. It's urgent. Globally, obesity affects a huge chunk of the adult population, something like 16% worldwide. But then you look at the U.S., and that number just jumps alarmingly to 42% of adults. 42%.
And this isn't just about weight on a scale. Obesity is linked to this whole cascade of serious health problems. Doctors often talk about this cluster of conditions using the term cardiovascular kidney metabolic syndrome, or CKM syndrome. The American Heart Association, for instance, they've actually identified excess body fat, particularly dysfunctional fat tissue, which is basically obesity, as stage 1 of this CKM syndrome pathway.
Stage 1. So the starting point for all these other issues.
Exactly. It's the foundation.
Yeah.
It significantly increases the risk for heart disease, type 2 diabetes, kidney problems, fatty liver disease, even certain cancers. And the economic cost is just staggering. Globally, the medical costs tied to high BMI are projected to hit over $4 trillion in the next decade.
Wow. Trillion.
Trillion, yeah. So given that huge health burden, that economic burden, the search for really effective treatments that go beyond just diet and exercise alone, which we know are often not enough for many people long term, that search has been this monumental effort. And that really is why there's so much excitement and maybe relief, too, around this newer class of drugs.
Okay, that sets the stage perfectly. So with all that crucial background, let's get down to it. Let's get to the brass tacks. What exactly is Wegovy, fundamentally? And how does it actually help people lose, well, such significant amounts of weight? Because this is where the science gets really, really interesting. The mechanism is actually quite elegant in a way. At its core, Wegovy is what's called a GLP-1 receptor agonist. Okay, let's break that down. GLP-1 stands for glucagon like peptide 1. Now, this isn't some totally artificial thing made from scratch in a lab. It's actually mimicking a natural hormone, an incretin hormone that your own gut releases. It's like a messenger signal. Your gut sends it out when you eat food. So think of it maybe like this. Your body already has this amazing, super sophisticated natural signaling system, right? You eat, your gut releases these GLP-1 messengers, and they basically signal to your brain, hey, food's arrived. Time to feel full, Caddy. Also tells your body to slow digestion down a bit, get ready to handle the sugar. What Wegovy does, essentially, is it mimics that natural GLP-1 signal. But here's the kicker. It doesn't just mimic it. It makes that signal much stronger, much louder, if you will. And crucially, it makes it last a lot longer than your body's own natural GLP-1 would normally hang around. So basically, it's boosting and extending this really intricate process your body already uses every single day to manage appetite, digestion, metabolism. It's like turning up the volume, and extending the broadcast time of your body's own I'm full message.
That's a perfect analogy. It really captures the essence. And the reason GLP-1 has such a wide-ranging impact on weight, on metabolic health, is because its action is truly multifaceted. When semaglutide comes in, mimics, and then really prolongs the effect of your natural GLP-1, it hits several key systems at once. Okay, first, and maybe the most noticeable thing for many people using it, is the impact on appetite and feeling full, satiety. See, GLP-1 receptors, they're found in really critical areas of the brain, especially the hypothalamus, the arcuate nucleus. These are like the command centers for regulating hunger, fullness, even the reward feelings we get from food. So when semaglutide activates these receptors, it directly changes the signals telling your brain if you're hungry or satisfied. And what's truly fascinating here, and you hear this a lot anecdotally from users, is this phenomenon people call the quieting of food noise.
Right, I've heard that exact phrase, food noise.
Yeah. Imagine this constant, background hum in your head about food. Planning the next meal, craving snacks, thinking about food, even when you're not physically hungry. For a lot of people struggling with weight, that's just their daily reality. It's exhausting. What semaglutide seems to do is profoundly change that mental landscape. Makes those constant thoughts about food less insistent, less demanding. And this isn't just about willpower, right? This is a deep biological modulation of desire. It's influencing the brain's reward pathways directly. Some people even report, anecdotally again, feeling less compulsion for other things too, like shopping or drinking too much.
Really? That's fascinating.
It suggests a kind of biological reset, almost, of the brain's relationship with reward and consumption. It's deeper than just feeling full. Okay, second big thing, and just as important for weight loss, semaglutide significantly slows down gastric emptying.
Gastric emptying,
Yeah.
meaning how fast food leaves your stomach.
Exactly. It slows down that process. So when your stomach empties more slowly, the food stays in your digestive system longer. This naturally makes you feel physically fuller and for a longer time after you've eaten, which pretty directly helps you eat less overall during the day. And this isn't just theory. It's been clearly shown in studies. Gerbsted et al. Back in 2018, Friedrichsen et al. In 2021. They detailed this effect, how it impacts blood sugar and fat levels after meals, confirming that delayed stomach emptying in people with obesity. It's like having a natural brake applied to your digestion, sort of. And third, this is really important too, while we know semaglutide helps control blood sugar in people with diabetes, it also plays a vital role in regulating glucose, even if you don't have diabetes. How it works is, it promotes insulin release from the pancreas, but only when glucose levels are high. It's glucose dependent.
Ah, okay, so it won't just drop your blood sugar too low.
Precisely. That glucose dependent part is key. It minimizes the risk of hypoglycemia, dangerously low blood sugar. At the same time, it suppresses glucagon. That's a hormone that usually raises blood sugar. So this dual action gives you really comprehensive blood sugar regulation. And remarkably, it can even lead to what's called regression to normoglycemia, basically, bringing blood sugar back into the normal range. And it can help prevent people at risk from actually developing type 2 diabetes.
Wow, so preventative benefits too.
Huge preventative benefits, yeah. Extending way beyond just weight loss itself. And if you compare this kind of multi-pronged approach to, older weight loss drugs, the difference is pretty stark. Older meds often had much more targeted mechanisms, sometimes less safe ones too. They might have just focused on, say, stimulating the nervous system to reduce appetite or blocking fat absorption, but sometimes that led to serious side effects, cardiovascular issues, psychological problems, semaglutide's broad impact hitting the gut-brain axis, metabolism, blood sugar, combined with its generally manageable safety profile. That's really what sets it apart. It's why it feels like such a game changer. It's a more kind of holistic physiological approach.
That definitely sounds incredibly impressive in theory. Understanding the biology is one thing, right? But the big question for most people is, does it actually work like that in the real world for lots of people? What's the hard data say? And this is where you mentioned those big clinical trials, the STEP program. That's where the evidence really comes from.
Absolutely.
Yeah.
The STEP program stands for Semaglutide Treatment Effect in people with obesity. It's this whole series of really well-designed, large-scale, randomized controlled trials. They've rigorously tested semaglutide specifically for weight management. And they've given us this enormous amount of data right up to that August 2025 cutoff we mentioned. They're really the foundation for understanding what this drug can do. Okay, so let's start with step one. This was kind of the flagship study published back in 2021 in a major journal. Really set a new standard. What it showed was an average, mind you, of 13.9% loss of body weight over 68 weeks. That was with semaglutide, 2.4 milligrams once a week, plus standard lifestyle advice. Now compare that to the placebo group in the same study. They only lost 2.4% on average.
14.9 versus 2.4. That's a huge difference.
Huge. Absolutely huge. Think about it for someone weighing, say, 200 pounds, almost 15% loss. That's nearly 30 pounds. And it wasn't just the average. The success rates for individuals were really striking. Like 86.4% of people on semaglutide lost at least 5% of their weight. That 5% mark is often considered clinically meaningful for health benefits. Even better, 69.1% lost 10% or more. And get this, 50.5%, over half the participants lost 15% or more of their starting weight.
Half the people lost over 15%. That's incredible.
It really is. And looking at pooled data across studies, it translates to a BMI drop of about 4.3 kilodalton doubt 2. That's statistically significant. And more importantly, clinically significant. Makes a real health difference. Okay, then there was step 3. This one looked at combining semaglutide with intensive behavioral therapy, like really intensive, plus an initial low-calorie diet phase. Here, the semaglutide group lost an average of 16% body weight. The group doing just the intensive therapy alone, they lost 5.7%. Still good, but way less than with the drug added.
So the intensive therapy helped a bit more on top of the drug.
It seems so, yeah, a little bit. 16% versus maybe closer to 15 without that super intensive start. What step 3 raises is this interesting question, right? How much intensive lifestyle change is really needed for the drug to work well? All of the step trials included lifestyle advice, but step 3 had this really rigorous program, frequent dietitian visits, structured low-calorie start. It showed that while the drug is clearly powerful on its own, adding more intensive support can potentially boost the results slightly, but maybe not as dramatically as you might think, given how strong the drug's effect is anyway. It points to a synergy, though. Now, step 4. This one, published in 2021, is so important for understanding the long-term picture. It used a clever study design. First, everyone got semaglutide for 20 weeks, and they lost weight, about 10.6% on average. Then they were randomly split. Half kept taking semaglutide, the other half were switched to a placebo, a dummy pill. And what happened was incredibly revealing. The group continuing semaglutide, they lost more weight, another 7.9%. But the group switched to placebo. They regained almost 7% of their weight.
Wow. So you stop the drug, the weight comes right back.
A significant amount of it, yes, very clearly. It just powerfully demonstrates the need for ongoing treatment to keep the weight off. It really drives home that idea of obesity as a chronic relapsing condition. Like high blood pressure or diabetes, you manage it long term. You stop the treatment, the condition often returns. Then step 5. This study gave us the longest term data specifically for semaglutide in people without diabetes, looking at weight management over 2 years. And it confirmed things beautifully. A sustained 15% weight loss maintained over that whole 2-year period. Plus, continued improvements in those important cardiovascular and metabolic risk factors we talked about. So it shows the effects are durable, they persist long term, which is exactly what you want for managing a chronic disease. And finally, step 6. This one specifically focused on East Asian adults. It showed very similar results, average weight loss of 13.2%. Now, some research does suggest there might be slight variations in weight loss response based on race or ethnicity, maybe due to subtle genetic or metabolic differences. But the key point is, semaglutide's effectiveness remained really strong and clinically meaningful across diverse groups. That's important for its use globally.
Okay, so the weight loss numbers are definitely undeniable, really impressive. But you mentioned other benefits too. Beyond just the scale, what else did these big trials uncover? Because, weight is one thing, but overall health, those deeper markers, that's often even more important long-term, right?
Exactly right. And the benefits of semaglutide really do go far beyond just shedding pounds. They have a profound impact on overall cardiovascular and metabolic health. The improvements we saw across the board in cardiometabolic markers, they're quite substantial, really paint a compelling picture. For instance, significant reductions in waist circumference. That's a key sign of reduced visceral fat, the dangerous fat around internal organs. Also, noticeable drops in C-reactive protein, CRP. That's a major marker of inflammation in the body. Lower is better. Blood pressure improved too. Studies showed average drops around 4.8 mmHg systolic, 2.4 mmHg diastolic, even in people without high blood pressure to begin with. That reduces strain on the heart.
So direct cardiovascular benefits even there.
Yeah, and even in people without diabetes, semaglutide led to significant improvements in HbA1c. That's your long-term blood sugar measure, and fasting blood sugar. This clearly shows that preventative effect we talked about. It can slow down, maybe even stop, the progression towards type 2 diabetes if you're at risk.
Plus, consistently better lipid profiles. Lower total cholesterol, lower triglycerides, and importantly, lower LDL cholesterol, the bad cholesterol. These aren't small tweaks. They add up to a substantial reduction in the overall risk of heart disease. But maybe the most profound finding, the real game changer for heart health, came from the SELECT trial. This was published in late 2023, a huge deal. It specifically looked at patients who already had cardiovascular disease, heart attack survivors, stroke survivors, etc., but who did not have diabetes and were overweight or obese. And the results were just groundbreaking. Semaglutide 2.4 milligrams once a week significantly cut the risk of major adverse cardiovascular events. It's a combo of cardiovascular death, non-fatal heart attack, or non-fatal stroke by 20% compared to placebo.
20% reduction in heart attacks and strokes in people without diabetes.
Exactly.
Yeah.
20% reduction in that combined outcome.
Okay.
It also reduced cardiovascular death specifically by 28% and death from any cause by 19%.
Wow, that is profound.
It really is, because it proves a direct cardiovascular benefit in patients without diabetes. Many thought the heart benefits of these drugs were mostly just due to better blood sugar control. SELECT challenges that. It suggests semaglutide has this independent protective effect on the cardiovascular system in this high-risk group, regardless of their blood sugar status. That's a revolutionary insight, and doesn't stop at the heart. There's also strong evidence for renal protection kidney benefits. Looking at pooled data from other big trials like SUSTAIN-6 and LEADER, they consistently showed less albuminuria, that's protein in the urine, an early sign of kidney damage, and a slower decline in kidney function, measured by eGFR, especially in patients who already had chronic kidney disease. So it seems to protect the kidneys too, broadening its benefits even further. And finally, beyond all the numbers and lab tests, it's about how people feel. Semaglutide also significantly improved patient scores on physical function questionnaires and overall quality of life measures. They use standard tools like the SF-36 survey, the IWQL-8 questionnaire, And people reported feeling better, having more energy, better mobility, just generally functioning better in their daily lives. So the benefits really hit multiple dimensions: physical health, metabolic health, and day-to-day well-being.
That is a truly comprehensive and, powerful picture of the benefits. It's absolutely clear why there's so much excitement. But as you always remind us, no medication, no matter how effective, is without potential downsides or things to consider. So as listeners are taking all this in, what are the common side effects people might run into? And what do we really need to understand about the overall safety profile when thinking about Wegovy?
That's the crucial flip side, isn't it? And having a balanced, realistic view is essential. Generally, semaglutide's safety profile is pretty consistent with the whole GLP-1 receptor agonist class. And for most people, the common side effects are manageable. And, key point, often temporary or transient. The most frequently reported side effects, mostly gastrointestinal. No surprise there, given how it works on the gut. Nausea is the big one, reported by about 44% of semaglutide users in trials like STEP 1, compared to maybe 17% in the placebo group. Diarrhea also common, around 31% versus 16% for placebo. Vomiting, maybe 25% versus 7%. And constipation, about 23% versus 9%.
Okay, so those GI issues are definitely pretty common then.
They are. But it's important to put those numbers in context. Usually these symptoms are mild to moderate. And here's the key thing. They are often transient. They tend to happen more at the beginning, especially when the dose is being increased as the body adapts. The good news is, most cases tend to get better over time without needing to stop the drug completely. Although it's true, some people do find them too bothersome and choose to stop because of them. Other common, but maybe less frequent things reported include like cold symptoms, nasopharyngitis, headaches, and reduced appetite itself, which, if severe, can be an issue. Okay, now let's talk about some of the more serious potential issues that have been discussed with this class of drugs. Gallbladder problems, like gallstones cholelithiasis is the medical term, did occur slightly more often, about 2.6% in semaglutide groups versus 1.2% with placebo. While gallstones can be serious, needing medical attention, it's still a relatively uncommon outcome overall, so its impact on the benefit-risk balance for most people is considered low. Pancreatitis inflammation of the pancreas has been a theoretical concern for the GLP-1 class.
In the semaglutide trials, it was reported, but infrequently, around 0.2% to 0.3% of patients. And crucially, when you look at large pooled analyses of many trials, often involving tens of thousands of patients followed for years, these big analyses have generally found no increased risk of acute pancreatitis or pancreatic cancer with these GLP-1 drugs.
So the big picture data doesn't show a clear link.
The big picture data is largely reassuring, yes. While some older, smaller studies maybe showed conflicting results, they often had other factors involved, like patients already having very high triglycerides or existing gallstone disease, which are known risks for pancreatitis anyway. So the consensus from the robust large-scale evidence is that the link is currently considered inconclusive or indicates no clear increased risk for the general user population. Another area you might have heard about is thyroid cancer, specifically a rare type called medullary thyroid cancer. This came up because studies in rats and mice did show an increased risk of these thyroid tumors, and that understandably led to a precaution. It's contraindicated, meaning shouldn't be used, in people with a personal or family history of medullary thyroid cancer or a rare genetic syndrome called MN22.
Okay, so a specific warning based on animal studies and rare conditions.
Exactly. But what about in humans generally? Well, the human studies investigating this are still considered inconclusive. There was one French study that suggested a possible increased risk of any type of thyroid cancer, but it had limitations. It didn't properly account for obesity itself being a risk factor for thyroid cancer. On the other hand, a big Scandinavian study found no increased risk over about 4 years of follow-up. The bottom line on thyroid cancer in humans is the current evidence is inconclusive. The contraindication is mainly a safety precaution based on animal data and those specific rare risk groups. And regarding suicidal thoughts, you sometimes see discussions online linking weight loss journeys and mental health, which is a valid conversation. But it's important to be precise here. The rigorous clinical trial data for semaglutide itself does not list suicidal thoughts as a direct side effect of the medication. We really need to stick to the documented adverse events from those controlled studies. And finally, hypoglycemia, low blood sugar. In people without diabetes taking Wegovy, the risk is very low, around 0.6%, basically the same as placebo, not a major concern for that group. With people with diabetes, it can happen more often, especially if they're also taking other diabetes meds like insulin, but severe low blood sugar was still rare in the trials. Now, it's fair to say that more people stopped taking semaglutide in the trials compared to placebo, about 7% versus 3%. And the main reason, overwhelmingly, was those GI side effects we talked about, nausea, vomiting, diarrhea. They accounted for about 4.5% of discontinuations in the semaglutide groups.
So tolerability is definitely a factor for some people.
It absolutely is. And that really highlights why starting with a low dose and increasing it slowly, that careful dose titration, is so important. It helps the body adjust and can minimize those initial side effects. Just a couple of other contraindications or things to keep in mind. Besides the thyroid cancer history, it's generally not recommended for patients with very severe heart failure, NYHA class 4, or end-stage kidney disease. This is mostly based on who was excluded from the big trials like SELECT. And there's this emerging point about gastroparesis, or slowed stomach emptying. Because the drug does this, there's a theoretical risk during anesthesia for surgery. Stomach contents could potentially be aspirated into the lungs.
Right, you wouldn't want food still in your stomach if you're having surgery.
Exactly. So the American Society of Anesthesiologists, ASA, actually recommends stopping GLP-1 drugs like Wegovy temporarily before elective procedures, maybe a day before, maybe up to a week, depending on the specific drug. Even if the patient feels fine, it's a precaution. Interestingly, though, some early research hints that maybe this stomach-slowing effect might lessen a bit with long-term use as the body adapts. Still being studied.
Okay, so it's crystal clear from all that data. Wegovy is definitely a powerful clinical tool. Significant benefits, but also a well-defined set of side effects. Manageable for most, but still important to know about. Now let's shift gears a bit. How is this all playing out in the real world, beyond the controlled setting of clinical trials? And what are the kind of broader conversations, the new research angles popping up as its popularity just keeps climbing? Because we've definitely seen its rise amplified hugely by social media. I mean, you see endless talk on Twitter, TikTok, people focusing on how well it works, but also sharing those really personal stories like the food noise disappearing you mentioned.
That's a huge part of the story now, the social and cultural impact. It's been massive. Analyses of platforms like Twitter definitely show this incredibly high public interest in semaglutide and similar drugs like liraglutide. The conversations mostly focus on efficacy, how well it works, and maybe a bit less on managing the side effects. Semaglutide in particular seems to have the biggest reach, the biggest impact on social media. Huge public awareness. And those user anecdotes you mentioned, they're really compelling. People describing that profound reduction in food compulsion noises, that constant mental chatter about eating. It's not just feeling physically less hungry. It's like a mental weight lifted for many. And then those more surprising anecdotes about feeling less drive towards other impulsive behaviors too, shopping, drinking.
Yeah, that's wild.
It really hints at this broader effect on the brain's reward circuitry. Goes way beyond just appetite control, suggests maybe a more fundamental recalibration of desire and impulse. Still early days understanding that fully, though. But this very popularity, this effectiveness, also shines a bright light on some major challenges, specifically around access and equity. These are not small issues. There are significant barriers. Things like tough insurance restrictions, needing a certain BMI, eating-related health conditions before they'll cover it. The sheer cost of the medication itself is prohibitive for many people if they don't have good insurance coverage. And we've seen periods of actual shortages where demand just outstrips supply, making it hard for people to even get their prescription filled.
Right, the supply issues have been big news.
They have. And when you put this in the broader context, remember, obesity disproportionately affects certain groups: people of color, those with lower incomes, less education. So when a highly effective treatment is expensive and hard to access, it unfortunately risks widening those existing health disparities, making it harder for those who might benefit most to actually get the treatment. It's a really complex ethical and public health problem we need to grapple with. Another key insight, really reinforced by real-world use in those long-term studies like Step 4, is hammering home the chronic nature of obesity and what happens when you stop treatment. Remember Step 4, the Step 1 extension. People regained, on average, 2/3 of the weight they'd lost within just a year of stopping semaglutide.
2/3 in a year. That's fast.
Yeah, it's incredibly significant. And it's not just a minor detail. It fundamentally changes how we have to think about managing obesity. It confirms, loud and clear, that obesity is a chronic, relapsing, progressive disease process, just like high blood pressure, which strongly implies that for many people, long-term, maybe even lifelong, treatment is needed to maintain the benefits, the weight loss, and the health improvements. It's not a short-term fix. It's not like taking an antibiotic for an infection. It's managing an ongoing condition. That's a crucial mindset shift. And looking forward, the science isn't standing still. Semaglutide was a massive breakthrough, but the field of these GLP-1 based therapies, and now multi-agonist therapies, is moving incredibly fast. For instance, there's tirzepatide. That's a dual agonist that hits both GLP-1 receptors and GIP receptors. GIP is another gut hormone involved in metabolism. And the results, even more weight loss than semaglutide in some trials, especially the SURMOUNT-1 trial for obesity specifically, showed an average weight loss of nearly 21% after 72 weeks. 21%. That's approaching bariatric surgery levels.
21% average. That's the next level up.
It really is. It's already got FDA Fast Track designation for obesity, signaling its huge potential. Then there are others in the pipeline. Ekaglutide, that's described as a CAMP-biased GLP-1 agonist. Early studies suggest it might be potent, maybe even more weight loss than semaglutide in animal models. What's really exciting about ekaglutide is the potential for an oral version, a pill. XW04 is in early trials now.
An oral pill instead of injections. That would be huge for convenience.
Absolutely. Game changer for many people. Phase 2 and 3 studies are ongoing or just finishing, so we'll see more human data soon. And pushing things even further, retatrutide. This one's a triple agonist. Hits GLP-1, GIP, and glucagon receptors. Glucagon normally raises blood sugar, but targeting its receptor this way might also boost energy expenditure and help appetite control. Early results show strong efficacy. This represents the next wave, hitting multiple metabolic pathways at once for potentially even greater effect. And there's orforglipron too, another one generating buzz as a daily oral GLP-1 option being developed. So the move towards effective oral versions is definitely a major trend. But amidst all this excitement about new drugs, there's a really critical point that often gets missed. Nutritional considerations. Think about bariatric surgery. There are really well-established guidelines for managing vitamin and mineral deficiencies afterwards, right? Because absorption changes, intake drops. But for these new weight loss medications, there are currently no standardized clinical guidelines for preventing or managing nutrient deficiencies.
Well, no guidelines for that.
Not standardized ones, no. And that's a huge gap. It's an area needing immediate attention, awareness, and urgent research. It basically means patients using these drugs need to be super proactive about their nutrition. Thinking about a daily multivitamin, making sure they get enough protein, especially since their appetite is down. And ideally, working closely with a registered dietitian, because their nutritional needs might change quite a bit with significant weight loss and reduced intake. It's an area where patients and their healthcare teams really need to be vigilant.
Okay, so after diving deep into the science, the trials, the side effects, the real-world stuff, what's the bottom line? What does this all mean for you, our listener, trying to make sense of this complex, fast-moving world of weight management? It seems profoundly clear that Wegovy and this whole class of drugs, the GLP-1s, they represent a genuinely significant leap forward in how we can treat obesity and all the health problems linked to it. The weight loss results are often life-changing. And those extra cardiovascular and metabolic benefits, like from the Select trial, they're frankly just incredibly impressive. It's more than we initially thought.
It is, but it's so important to maintain that balanced view. Wegovy is not a magic bullet. It won't make all effort disappear. It's a powerful, highly effective tool for many people, yes, but it's a tool within a bigger picture. Because obesity, as we keep saying, is a chronic disease. It needs ongoing, often lifelong management. We saw it clearly in the trials. Stop the medication, and the weight tends to come back, often quite a bit of it. That just underscores the need for long-term commitment, either to the medication itself or to developing really robust alternative strategies if it has to be stopped. It's an ongoing health journey. So that means any decision about using these drugs absolutely needs a thorough, personalized assessment by a doctor, by a healthcare professional. They have to look at your specific health history, any of the conditions you have, potential contraindications like that family history of thyroid cancer, or maybe severe stomach issues. And while those GI side effects are often manageable and temporary, they can lead some people to stop. A good doctor can help set expectations, guide you through starting to go slowly, offer tips to manage side effects. It really needs to be a partnership.
And this brings us back to something absolutely crucial, something that cannot be overstated. The vital, irreplaceable role of lifestyle changes. Healthy eating, physical activity, even with these incredibly effective drugs, lifestyle remains foundational. It's not an either. Remember, all the major trials included lifestyle interventions alongside the medication. For very good reasons. Healthy eating and exercise provide important additional benefits. They boost overall health way beyond just the number on the scale.
Right, things like mood, energy.
Yeah, exactly. Mood, energy, preserving muscle mass while losing fat, better sleep, preventing other diseases. The list goes on. The medication kind of sets the stage, makes it easier perhaps, but the lifestyle habits solidify and broaden the health gains. And practically speaking, this doesn't mean aiming for something extreme or unsustainable. We're talking about achievable goals, a moderate calorie reduction that feels right for you long term. Aiming for that standard recommendation, at least 150 minutes of moderate aerobic activity a week, like a brisk walk 30 minutes, 5 days a week, and adding in a couple of sessions of muscle strengthening activities. These are sustainable targets. They really complement the drug's effects and help build overall health. Also, getting ongoing support can be huge. Talking regularly with a dietitian, maybe a health coach. That support helps with motivation, navigating challenges, building skills for the long haul, and keeping track of yourself. Food intake, activity, taking the medication, especially early on, seems really key for success too. So if you are considering semaglutide or a similar medication, what should you actually ask your doctor? Here are a few concrete questions. First, based on my specific health history, my current conditions, other meds I take, is this drug actually a suitable and safe choice for me?
Good one. Personalized risk benefit.
Exactly. Second, what specific side effects should I be most aware of, especially when starting? And what's our plan to manage them if they happen? Third, what's the long-term plan here? How long might I need to take this? And crucially, what happens if I need to stop it for some reason?
Yeah, the exit strategy or continuation plan.
Right. Fourth, how do we best integrate diet and exercise? What support or resources can you offer or refer me to for those lifestyle changes? And maybe fifth, are there any specific worries based on my past medical issues, like stomach problems I've had before or any surgeries coming up?
This whole deep dive into Wegovy, into these GLP-1 drugs, it really does highlight this fundamental kind of exciting shift in how we're starting to approach chronic diseases like obesity. It feels like we're moving beyond just symptom management. We're intervening at a much deeper physiological level, reshaping health outcomes for so many people. So what does this mean for the future? For personalized medicine, tailoring treatments even more precisely, and how might our whole understanding of healthy living itself continue to change now that we have these powerful pharmacological tools that can profoundly alter our relationship with food, our metabolism. It's a really fascinating future to think about. Huge potential, but also lots of new questions to explore. Our goal here, as always on the deep dive, is just to equip you, our listener, to be really well informed, to help you ask better questions, to understand these complex topics shaping our health and our world. So keep that curiosity going, keep exploring, and definitely keep diving deep with us.